Let's Cover That podcast is brought to you by CM&F Group, professional liability services for over 200 healthcare professions. Visit our website at cmfgroup.com/podcast for more info.
Hey everyone, another wonderful episode of Let's Cover That. I'm your co-host, Will Sullivan.
And I'm your co-host, Antonina Aguirre. And today on the podcast, we have Kevin Mercier, Director of Strategic Development of FYZICAL. Kevin, we're super excited to have you on the show today.
Thanks for having me.
Of course. So, Kevin, tell us a little bit about FYZICAL and what kind of brought you into the healthcare system.
Sure. Yeah, so back in 2011, I graduated college, and part of that boomerang generation came back and lived with my parents looking for a job. And I saw an opportunity to start working with the founder at that point in time, Jim Abrams, and actually joined him as almost like an executive assistant. At that point, he was starting the brand, and was it 11 years later now? We started franchising in 2013. The company was founded in 2012, and we've grown to 460 clinics across 46 states. So it's been a fun ride. I've had about 7 or 8 seats along the way, but it's definitely been an interesting ride.
So tell us, what is FYZICAL and how does it differentiate from your competitors in the market?
Sure. So we are physical therapy and balance centers. We're an outpatient private practice physical therapy franchise brand. We actually like to call ourselves a healthcare brand because we're more than just physical therapy, but the primary differentiator is going to be balance. So physical therapy and balance centers, we are the experts in that space from a clinical standpoint on how to be able to help not only people with vestibular challenges, but those at risk for a fall. And it's really been the primary differentiator in the marketplace for us.
So when you kind of get into where you guys are focused, Kevin, I mean, when you're doing the franchise business model, what kind of differentiates you when you're talking to physical therapists out there historically? I know you've transitioned to having maybe non-clinical owners in some of these franchises over the past few years, but what's the differentiating piece that you offer to a physical therapist who is either A, looking to open up their own clinic, or B, looking to kind of transition in their clinic into a new business model with you? What's kind of the differentiator that kind of brings them in?
Sure. So I think the easiest way that I've heard this described is with 3 B's. So the first one is balance, which I just talked about. So historically, like you just mentioned, Will, we were when we were founded and started franchising, we were working with mostly mom and pop private practices that converted their businesses over. So Antonina's Physical Therapy with 1 or 2 locations converted over to FYZICAL of Tampa. And the 3 B's that I mentioned there were balance and business. So Antonina might have been the best clinician in the Tampa Bay area, but may not have known exactly how to run a business. So the business systems that we were able to help these owners kind of implement, and branding. So as we grow, we think that'll probably become the number one benefit of why you take advantage of joining FYZICAL. And actually, in the past 2 to 3 years, like you mentioned there, Will, we've had a pretty significant turn on our development strategy. While we do still have these private practices conversions coming over to join FYZICAL, we have a pretty significant influx of investors and startup businesses. We've got 460 clinics open. We've got another 190 in our development pipeline that have identified their territory and are anywhere from grand opening today to maybe 2 years down the road, give or take.
Yeah, that's incredible. How's that worked with, two things kind of going in order? Number one, increase of direct access to physical therapists in a lot of states across the country, but then also kind of taking a turn economically through COVID. So how's that kind of transition people's desire to transition into a FYZICAL? And then to your point, they might be mom and pop, great clinicians, but not the brand, not the business bees, and wanting to expand out to a multi-site clinic operation too. It's not like you stay static. So how's the direct access to care kind of transition with the country? kind of help explode that, but then also kind of handling the COVID too. That's the in-person kind of clinical operation of physical therapy. How's that dynamic kind of moved you guys in the past 2, 3 years?
Sure. It kind of a two-leg question there. So the first being the direct access. Now, unfortunately, as our industry's progressed here, we're still 90 to 95% insurance driven. Um, it's a combination of consumer education and them actually knowing if they can or not go into a physical therapist without a referral. Um, so that's still a key part of it. But the second part to your question about post COVID, so the supply for PT or the demand for PT services right now is really greater than ever. And just like any industry, the staffing has been one of the biggest challenges. But those that are providing answers for taking care of their employees and being able to kind of help grow and take care of the patients in their market are really getting a pretty significant leap over those that aren't. So when one of the benefits of joining physical and the franchise that we have is we have a pretty significant recruiting pipeline and strategy and partnership with one of our partners, Talent Care, to be able to drive the growth for our clinics.
Amazing. And just insane growth over the years, Kevin. Are there any particular partnerships you guys are working on right now that you think will really kind of catapult the growth even further?
Yeah, there's a few. I mean, one of them is our BI platform. So we're building a pretty significant business intelligence program internally with our EMR partner, but also something that we're doing with our billing and internally with our analyst team. So the data that we've been able to accumulate not only in the past 12 months, but what we're building for the next 6, 12, 18 months is something that some may look back and say, what took us so long to put something like this together? But cup half full, it's pretty impressive what we're going to be able to do with the data that we're collecting, not only for patient outcomes and for their individual practices, but any insurance negotiations that we'll be able to kind of push forward with that data. So that would be one. I think another one that is probably a little too early to dive too deep into, but we're actually running a pilot in one of our company clinics in Fort Myers. So out of the 460 clinics, we as the franchisor actually operate 57 of those clinics. So we kind of have those as a test kitchen as well to try different things out. So we have a cash-based service that I can't really speak to just yet because it's just getting launched this week, but it's about 1,200 to 1,400 square feet in that facility, and it's entirely cash and consumer driven, but it's an ancillary service to physical therapy. So could be a potential game changer for us, but it's very early. So I'll definitely poke Will when that thing's off and rolling, and maybe we can hop back on together and talk a little bit about what that's like.
I think like one of the natural extensions, not sure if this kind of falls within the same wheelhouse, but one of the natural extensions of physical therapy is just being physical, specifically as in you're working out, you might have a rotator cuff issue or you have your balance issue and you're kind of done with the protocols and the patient outcomes. But then there's kind of a return factor that you guys have kind of put together on more of like a, medically oriented gym, I guess a lot of people kind of call it that. And that's part of like a natural extension that you guys have tested out previously already. I just see that as just makes sense to kind of start pulling in nutrition and different aspects from that perspective, where when you're dealing with referrals from a physician base or hospitals like HSS, they would just love to have an outpatient capability like you all. Are those the type of things you've kind of seen natural extensions and more desire from people coming in the door?
It is, yeah. So you poked on nutrition there, so that's definitely one key part that we've kept hearing about, and we actually just launched an exclusive supplement label line to our community as well. So it's brand new, and we're hoping to put some e-commerce opportunity behind it too for our members. So it's another way for these members to be able to take care of these patients and provide them a very high quality product rather than going out to Walgreens and picking something off the shelf that they might not know is the right thing for them. So exactly your point there. These are healthcare professionals, physical therapists that know more about the musculoskeletal system than anybody else, and they know what their specific patients are going to need. But the fitness side of it, yeah, I mean, we've got, I'd say probably out of our 460 locations, about 80 to 100 of them are working some type of fitness within their facility, which is great because, they've got the equipment, they've got the space, and they've got human body experts in the clinic and making sure that the patients are doing what they should be doing. So it's definitely a different patient than you'd see, or person walking around a Gold's Gym or something like that. These are individuals that want to be able to spend time with their family and run around with their kids rather than busting out of a tank top kind of thing. So um, it's the reason we like to call ourselves a healthcare organization more than a physical therapy company, because our mission, I'm going to poke my head over on the wall here so I get it right, but we are, every day we empower individuals to take control of their recovery and wellness through direct access to physical therapy, balance protocols, and healthy lifestyle products and services. So I think that echoes exactly what you had mentioned there.
Amazing. Kevin, you touched on the fact that you're assisting these private practices into kind of buying a franchise, and exactly what is the impact that that's having? Are any of these owners coming to you and saying, wow, this has really changed X for me? Is it the financial side? Is it the scheduling client side? What has been, the conversation from the owners?
Yeah, every business is kind of like a snowflake. So everyone's situation is typically different. We've had solo practitioners join in 500 square feet. And we've had 10 location businesses convert over to physical as well. So the business side is typical, and the majority of them are usually in that 2 to 4 location business. And being able to kind of implement our business systems and put our partnerships into place, because as we've grown, we've been able to establish some pretty significant pricing discounts for equipment and supply. We've got a really great partnership on the EMR and billing side and payroll and recruiting. We've got some killer marketing partnerships that we've done some special things with over the past year specifically. And then as you're opening, if you are a single practice, that might have taken you 18, 36 months to be able to put together the clinic as you see it today. But when you open your second, third, fourth location, that's really what's changed in the past year or two for us. We've got a significant construction and pre-opening team, as well as a real estate team that helps you kind of expedite the opening process and make sure that you're selecting appropriate sites and that kind of stuff.
So, kind of to bring us closer to a wrap up, what are the type of things that you see as like long-term milestones for physical at this point? What excites you guys really?
Yeah, the exciting thing is yeah, the exciting thing is we're still fairly young, and we're still there's still a bunch of opportunity and territory across the U.S. today. So we're, as long as we don't run into something crazy again like we did in 2020, we should hit 500 open clinics this year, which is a pretty big milestone, I believe. We believe we're going to open 90 clinics this year, which would be our largest year to date for how many clinics we open. And what we're doing as a brand each and every year that passes by is better and stronger than the year before. As we expand, we're bringing in more experts, not only from the business and financial side, but the clinical side as well. So we've got experts that are entirely driven towards educating and providing this free continuing education to our franchisees for balance and pelvic and orthopedic, TMJ, hips, that kind of thing. So it's really kind of a ball rolling down a hill, a snowball kind of avalanche effect that as the brand expands, our education and knowledge expands as well. So it's been a fun ride.
Really awesome work that you and your team are doing, Kevin. We really appreciate your time today. We loved learning about Physical. Is there somewhere that our listeners can tune in to learn more about what you guys are doing?
Yeah, I'd recommend. So physical.com is our consumer site. If you or any of your loved ones are facing any challenges and need some physical therapy, if you're interested in learning more about the franchise, it's physicalfranchise.com.